Hello all, my name is Perrin. I'm one of the R3 residents here at UC Davis. I am joined by Manav and Jenny, who are our respective third and fourth year radiology chief residents. We just wanted to take this opportunity to introduce you to our radiology department. We'll give you a brief tour, a virtual tour, and highlight some of the main areas where we spend the majority of our time during our training here at UC Davis.
We'll begin in the Neuroradiology Reading Room. In the Neuro Reading Room, residents, fellows, and attendings work at their own dedicated workstations, but together in teams to handle different responsibilities. First, the consult resident is in charge of overseeing all inpatient and emergency room studies and making sure these studies are dictated in a timely manner. It's during this time that residents become comfortable making acute decisions which often affect medical management. Frequently, inpatient clinical teams come to the neuro room in person to review studies. This resident, along with their attending, will be responsible to answer their questions. The spine resident and attending cover all procedures during the rotation. This includes lumbar punctures, myelograms, occasionally vertebroplasties, and also intrathecal chemotherapy treatments. When the resident's not performing procedures, they help out with the outpatient imaging studies list. And the third team focuses on reading the outpatient studies, which are scanned at our main hospital, our ambulatory care center, or one of the other UC Davis imaging centers in the greater Sacramento area.
So this is the interventional radiology workroom. It's located adjacent to the 5 IR suites that we have and right next door to the neuroradiology reading room. Typically, the day starts at around 7 a.m., where the fellow and the resident will pre-round all of the patients for the morning cases. They'll additionally look over any overnight cases that might have happened and any new consult that happened after hours between the previous day and the morning of. Morning rounds begin around 7:30 a.m. They're led by the resident, and all team members are present for these rounds, which include the IR attendings, the fellows, the nurses, the IR technologists, and the physician assistants. And throughout the day, this will be typically our home base, where we'll be in this room in between performing procedures and writing notes. In addition, this is a room where we'll be fielding consults for the day for any inpatient or ED requests, as well as coordinating any aftercare visits if they may need them. So this is an example of one of our body reading rooms, and unfortunately, it's undergoing renovation right now, so you'll just have to take my word for it when I say that this will probably be one of the more attractive reading rooms that we will have in our radiology department when you guys start as residents. It's located in the heart of the radiology department. There's a good mix of residents, fellows, and attendings, and we share this space collaboratively when we read out MRIs, CTs, ultrasounds, and fluoroscopic studies. So depending on what rotation you're on, you will be in this space. It's a really great collaborative environment where you can just walk a few steps down the hallway and get another radiologist's opinion or share an interesting case.
During the body intervention rotation, we focus on procedures and read diagnostic studies when time allows. Typically, our team working in this room consists of an attending, a fellow, and a nurse. The fellow and resident lead rounds every morning and field consults throughout the day. We have a paracentesis and a thoracentesis clinic that's run by our radiology NPs and one of our body attendings, where R1s get their initial hands-on experience. And then shortly thereafter, residents get to participate in a variety of cases, including radiofrequency ablations, drain placements, ultrasound, and CT guided biopsies. Residents enjoy having this additional procedure rotation in addition to interventional radiology.
Here's our ER reading room. We spend a lot of time here since it serves as the home base for our chest radiograph rotation, our chest CT rotation, as well as for our call shifts, which include the overnight shifts for R3s and R4s. It is located right next to the ER, so clinicians frequently drop by to ask questions and review imaging. We have an administrative assistant in this room 24/7 to help triage any phone calls. It's also located next to several of our CT scanners, so we can easily pop by for any CT procedures, such as lung biopsies, or anything that the CT technologist might need help with.
In the pediatric reading room, we sit at dedicated workstations to read and collaborate on cases with pediatric teams. It's located right next to our dedicated and newly renovated pediatric fluoroscopy room for quick access to procedures. We also work very closely with our dedicated child life staff who help kids feel comfortable and safe during their visit to radiology.
Here's our newly renovated radiology resident library. Here we have 2 computers, a large high-definition TV, large comfortable couches and desks, as well as where we get our mail. Some residents use this space to play board games after work. You can also find resident portraits we painted for each other during our most recent resident retreat, and some are definitely better painters than others.
In the nuclear medicine reading room, we learn all aspects of general nuclear medicine, cardiac nuclear medicine, which includes myocardial perfusion imaging, cardiac amyloid, cardiac sarcoid, and viability studies, as well as PET-CT. Residents work closely with our nuclear medicine technologist to learn nuclear medicine physics, quality control, and how images are acquired. This is frequently useful, particularly when preparing for boards. On the first rotation, R1s focus on general nuclear medicine and cardiac, and then throughout later rotations, R2s through R4s have dedicated weeks to read PET-CTs. We have a new state-of-the-art scanner called the Explorer, which has been used extensively in both research and clinical applications at UC Davis.
Here's an example of one of the breast imaging reading rooms located in the Lawrence Ellison Ambulatory Care Center, also known as the ACC, which is located a short walk from the main hospital. Both Hologic and PACS workstations are available at every desk. We work with the fellows and attendings on screening mammography, diagnostic mammography and ultrasounds, MRIs, and performing all image-guided procedures under all modalities, including stereotactic, ultrasound-guided, MRI-guided biopsies, and wire and seed localizations. The mammography rooms, the dedicated breast ultrasound rooms, procedure rooms, and the technologist work area are right next to each other, allowing ease of access.
This is the MSK reading room. It's located in the Lawrence Ellison Ambulatory Care Center. So during your first year, you'll get a lot of experience reading MSK plain films. As you progress during residency, you'll start reading CTs and MRIs. So there are 2 reading rooms. This is the upper floor reading room. There's also an additional reading room on the lower floor. As far as procedural responsibilities, the residents on this rotation will be responsible for all sorts of procedures, which include steroid injections, arthrograms, and bone biopsies. And then also throughout the week, there are multidisciplinary conferences, which include the Sarcoma Case Conference, Interesting Case Conference, and Rheumatology Conference. And during your senior years, you may ask to be lead one of these conferences as well.